Artificial intelligence is transforming healthcare across the country, both in positive and negative ways. We spoke to the president of the American Association of Nurse Practitioners, Valerie Fuller, a Farmington native, about the changes she's seen with AI. The AANP says patients who use AI are encountering a lot of misinformation. Dr. Fuller says she's seen chatbots give false diagnosis and in one case make up an organ that doesn't exist. She says the responsible way to interact with AI is to use it as a starting point, then verify any information with your healthcare provider.
For example, if you've spoken to your provider and they say you have hypothyroidism, a low thyroid, AI can actually, give you some good information, but I do think it's important that if you don't understand that information and to review that information with your nurse practitioner, because again, it isn't always accurate, even though it can sound accurate.
She says nurse practitioners are especially skilled at helping patients navigate AI because they are trained educators and are typically able to spend more time with patients than some other providers.